Hi, my name is Dr. Kurtis Kozel, and I'm here today with Dr. Heidi, and we're here to discuss the Patient Protection and Affordable Care Act and its impact on physicians from the physician's perspective. I can go ahead and make my opening statement. I think that the ACA is a great thing for physicians because it will increase the physician's income, it will strengthen the bond between physicians and their patients, and it will increase the quality of a doctor's care and decrease the amount of lawsuits presented against doctors in the United States of America. Heidi, any opening statements?
Yes, on behalf of the physicians that don't support the Affordable Care Act, a lot of us kind of come at this from the stance that we think it's going to introduce unnecessary red tape to our practice. We actually think it's going to lower physicians' income, and we think this introduces bureaucrats in between the physician and patient relationship, and we don't believe that they have grounds to do so.
Thank you, Dr. Gray. First off, I'd like to open my argument with the fact that the largest medical association in the United States of America, which is the American Medical Association, has expressed strong support for this legislation even before it passed. I think this shows strong benefit for the physicians as shown through their support.
What we often leave out when we use the argument the American Medical Association supports it is the fact that only 17% of physicians that are practicing in the United States are a part of the AMA. And furthermore, if you look back between 2010 and 2011 during the implementation process, a lot of doctors actually pulled their membership. And also the ones that never joined the AMA and don't support ACA, they fear it's because of that red tape and that regulation.
Well, the reason the ACA put in these red tape and put in these regulations is to increase the quality of care that the doctors are providing to their patients and making sure that the patients are getting the same quality of care everywhere they go. These quality regulations will decrease the amount of lawsuits presented against the doctors because they will be required by law to keep up to these proper standards and treat these patients properly. No matter where they go, whether they are in North Carolina, North Dakota, or New York.
Kind of building off of what you said about the quality standards, they're going to apply that across the regions, and we know very well that demographics change from community to community, let alone from state to state. So, the way they're going to work this is they're going to penalize those people that don't have the same outcomes as neighboring physicians. And I guess you could use an example, a Harlem physician versus someone at Wake Med. They have different demographics, better compliance at Wake Med than what you're going to see in Harlem. And so, yes, as physicians, we view it as a compliance nightmare, and it's going to take off our earnings because we're going to get penalized for not having the same outcomes as physicians in better areas.
We talk about these penalizations, and really what these penalizations are they're not comparing Wake Med to Harlem, they're comparing Harlem to Harlem. They're making sure that the patients in Harlem are getting better care than they received previously, and they're making sure that the patients are getting healthier and staying healthier over time. And over time, these penalizations will actually decrease to the fact that I think they will become a bonus for the doctor if they stay up that high. And if you're talking about income, as you mentioned, 22 million more Americans are now enrolled in healthcare as a result of ACA. And these patients are now in the healthcare system, increasing the income of doctors in the healthcare system because of the insurance and because they are covered. Well, otherwise it might not have been. Like these low-income people in Harlem, they would not have been able to afford healthcare previously, and now they are. Now they are able to get healthier and increase the amount of money put into those doctor hospitals that they visit.
I think we all know that the main purpose of ACA was to be access to quality health care, which is, a noble effort. But we have to remember that when you provide a service or a good that wasn't previously available to a certain population, especially a large number like you suggested, that money has to come from somewhere. Someone has to pay for that. And we see it with Medicaid being expanded and taking from Medicare. And so, yes, we're getting more people with access, but are we really achieving this equality that you speak of?
Well, really over time, this should potentially pay for itself and actually maybe generate some revenue for the American medical system and American government. And in terms of the doctors aren't really paying that much money if they follow the proper regulations, and if they follow ACA to the letter, they should be making more money than they did before.
But we must also point out that with the Medicaid expansion, they're only going to get 56% as what they would have gotten from a private insurance paying customer.
But with so many more individuals in the healthcare system, I think though that should even out in terms of doctor income.